Pharmacology 2 Presentation. Hello everyone, let's talk about biologic DMARDS. So first of all, we need to know what is rheumatoid arthritis. Rheumatoid arthritis is autoimmune disease. The body immune system mistakenly attacks the joints, affect around 450,000 of Australian and approximately 1% of world population. The treatment of rheumatoid arthritis includes surgery, medication for pain control and anti-inflammation, alter the course of disease, and promote disease remission. DMARDS stand for disease-modifying anti-rheumatic drugs. There are two types of DMARDS, biological and conventional. First of all, let's talk about conventional DMARDS. Conventional DMARDs are a group of slowly acting drugs and can take several weeks to work, so it's important to keep taking them even if they do not seem to have any effect at first. Biologic DMARDs are the newer drugs. They target individual molecules and tend to work more quickly than the conventional DMARDs. It is a genetically engineered protein derived from human genes, designed to inhibit the specific components of the immune system, help to reduce the symptom of the disease by targeting the body's own immune systems, slowing down the inflammation process. There are four major types of biological therapy: anti-tumor necrosis factor drugs, B-cell specific CD20 antigen, T-cell co-stimulation inhibitors, interleukin-6 receptor inhibitors. Those therapies help to prevent joint and cartilage damage and may produce major improvement in many patients. Tumor necrosis factor alpha mechanism of action. It is a cytokine secreted by macrophage in response to inflammatory stimuli and involved in immunoregulation and inflammation as well as sepsis. Anti-TNF medications such as infliximab suppress the joint inflammatory response. Rituximab mechanism of action. Rituximab antibody tend to stick to B-cell surface CD20 proteins, forming a cap and draw proteins over to the side. The presence of the cap changing the effectiveness of natural killer cells in destroying the B-cells. When natural killer cells launch onto the cap, it had 80% success rate at killing the cells. Adatacept, primary T-cell effects, competitive inhibition of CD28 binding to CD80 or 86, increase the threshold for T-cell activation, activation for IDU modulate APC function, decrease the proliferation of de novo recirculate T-cells, decrease inflammatory mediation. Tocilizumab, interleukin-6 is a cytokine that plays an important role in immune response and is implicated in pathogenesis of many diseases. Tocilizumab binds cells as well as membrane-bound interleukin-6 receptor, hindering interleukin-6 from exerting its pro-inflammatory effects. Side effects. Biological DMARDs vary in their side effects due to the varying mechanism of action. 12 to 13% of patients experience life-threatening reaction. Symptoms of infusion reactions include flu-like illness, fever, chill, nausea, and headache. Side effect of infliximab increase the risk of viral infection, hematological disorder, headache and dizziness, upper GI infection, skin rashes. Side effect of rituximab increase the risk of infection in both bacterial and viral, blood and lymphopathic disorder, metabolic disorder, coagulation disorder. The effect of adatacept, injection site irritation, increase infection risk, malignancy include basal cell carcinoma and dizziness. Tocilizumab side effects include upper respiratory tract infection, nasopharyngitis, enzyme alanine transamine was also elevated total cholesterol is common. One of the examples of biological DMARDs monotherapy is tocilizumab, which is the first biological agent to demonstrate statistically superior as monotherapy compared with conventional methotrexate in patients with early active rheumatoid arthritis. It's relatively safe, hence is favorable for most of the patients. Benefits of combination therapy can include less joint pain, morning sickness, and inflammation. It can also help slow or stop the disease from worsening. Combination therapy cannot reverse your joint damage that you already have. Unlike conventional DMARDs that take over several weeks to work, biological DMARDs respond at early time, hence short-acting, and tend to be more expensive. The major drawback to the widespread use of the drugs is marked by the serious risk of infections and malignancy. Thank you for watching.
created using Powtoon.